Vou pegar meu fone. Fala, pessoal! Por enquanto ninguém online. Vamos esperando. Uma pessoa online?
Quem é?
Não sei ainda. Por favor, identifique-se para a gente conhecer você. Or please, identify yourself. Pessoal,
pode falar, não precisa ficar tímido. Aqui não é lugar para timidez.
Aqui não é lugar para timidez. Pessoal, enquanto o pessoal vai entrando, vão dizendo de onde você está falando. É sempre legal, num evento de Global Health, a gente saber de onde as pessoas que estão acompanhando a gente estão falando. No momento estamos em 5 pessoas, aumentando mais uns 5 minutinhos e a gente começa. O Joel, ele está com algum problema para se conectar. Mas a gente já está começando, tá bom? Por enquanto, deixa aqui do lado, ou se você estiver no celular, tem um chat para você colocar a sua mensagem. Bom, eu falo de Curitiba, hoje a Juliana, que está aqui do lado, fala aqui de Curitiba, veio visitar a Terra da Chuva. Seja bem-vinda, Ju.
Obrigada, estou feliz de estar em Curitiba. E eu não sei se isso é queimação de filme, mas semana passada, meu pai foi online para assistir a aula de sarampo. Meu pai, que é advogado, não tem nada a ver com a área, mas eu falei que hoje, se ele aparecer, ele tem que me falar.
O argentino, mais uma vez, aqui conosco, acompanhando todos, argentino. Teu nome é argentino mesmo? É muito, muito legal você chamá-lo de argentino. Fala de BH, Minas Gerais. Seja bem-vindo. Aqui, como é de praxe, a gente sempre tem gente do Brasil inteiro, tem gente da Paraíba, do Acre, já tivemos de Portugal, já tivemos da Rússia. A Juliana sempre está lá em Nova York, só dessa vez que ela está por aqui. Vou visitando a terra, da onde saiu. Faz quanto tempo que você está morando em Nova York, Ju?
Eu estou em Nova York há 7 anos e saí do Brasil há 13 anos.
Entendi. E conta um pouquinho, enquanto eu vou tentar buscar o Joel, da tua história na África, como é que foi que essa tua rotina e por que você fala tanto de Global Health, assim?
Então, tá bom. Então, para quem não me conhece, eu sou Juliana Soares Lin, eu sou médica, sou formada na Federal do Paraná, em medicina, fiz clínica médica, residência médica na Federal do Espírito Santo, eu sou originalmente do Espírito Santo, e daí, durante a minha residência médica, surgiu uma oportunidade, um convite, de fazer um estágio na África, como parte da minha residência, através da Universidade de Columbia University em Nova York, que estava começando um programa grande para tratamento de HIV em África e Ásia. Então, eu, como na época falava inglês, português, eles estavam procurando médicos com aquele perfil, eu fui para lá, e uma experiência que transformou a minha vida, e eles, enfim, abriram vagas, eu me candidatei e terminei mudando no fim da residência mesmo, tipo, eu terminei hoje, no dia eu me mudei para Moçambique e fiquei lá 5 anos. E meu trabalho em Moçambique, na verdade, eu cheguei lá achava que era para prestar assistência e entrei no mundo de Global Health, que é um mundo de trabalhar junto com o Ministério da Saúde de Moçambique mesmo, para criar condições de expansão do tratamento antirretroviral para aquela população. Eu fiquei 5 anos em Moçambique com a University e daí me mudei para Nova York. Nesse período, eu fiz um mestrado em doenças infecciosas pela London School of Hygiene and Tropical Medicine e fiz um mestrado na Columbia em epidemiologia. E hoje, enfim, eu sou vice-diretora da unidade de implementação de um centro da Columbia University. You see me. Hi, Joel. O Joel disse que entrou. We need to
Joel,
see you as well. Turn on your camera.
Yeah, you can find the button right over here. Oh, now we see you, but we don't hear you. And the next button you can click to.
There we go.
Now we hear. Okay.
Do you hear me?
Yes.
Okay. Good. Okay. Thank you very much. I'm sorry I interrupted you, Juliana.
No
go
problem.
on.
I was just telling them about my life. Mas então eu agora trabalho na Colômbia com Global Health. Continuo apaixonada por HIV, mas o foco do centro que eu trabalho é realmente Global Health, e a gente trabalha com ebola, malária, enfim, várias coisas. E, enfim, essa do que eu sou é porque eu e o Fernando, a gente achou que esse tema seria um tema interessante para trabalhar com a população brasileira.
Cirurgia é sempre muito interessante, né? Eu sou um cirurgião que não foi pelo caminho da cirurgia, me desviei no meio do caminho, mas eu sempre gostei muito. Durante a faculdade eu fiz muito estágio em cirurgia. So, Joel, nice to meet you. I can't hear you.
You need to turn on your mic.
Very. So I'm sorry, I'm technologically not very good. Okay, so now you can see me, and I think I'm trying to center myself for this camera.
Okay.
I do this very often. Okay.
Yes,
there we go.
So this is our Global Health League, our community of practice in global health. Juliana told you a lot about you, and our what we want to do with that is to connect different people from different countries to talk about global health and One Health approach. So welcome, and Juliana, probably you will be our hostess today, and we can start. And
so why don't we start with Joel maybe introducing himself and then.
Please.
Yeah. So first, it's a pleasure to be part of this conversation, and I hope that this is not the last time. I would love to participate in this very important initiative. I think there are a lot of us who are a lot of surgeons who are very interested in global surgery and global health, and from personal experience, it can be very difficult, challenging, sometimes confusing as to how to get involved. There is no one way of getting involved. So I'll just say a little bit about myself, and then I can go into any more detail as you wish. But I mainly want people to if they have any questions. But I grew up in the United States, and I went to medical school. And college and medical school here, and I can tell you a little bit about my educational background. I started my career thinking that I wanted to be in public health and development, meaning and after finishing college, I was very interested in medicine, but I was mainly interested in public health and development. So right after college, I decided to not go to medical school, and I moved to Bolivia. And there I worked for an NGO, a health NGO. And please, if there's any translation that needs to be done, please interrupt me. If there's any term that you think our audience might be better served by translating, please let me know and just interrupt me anytime. I tend to ramble sometimes. But after finishing college, I moved to Bolivia, and I worked for a health NGO for about a year and a half, mainly helping with vaccinations and educational programs, like identification of serious upper respiratory infections and things like that. But after a year and a half, I realized what I really enjoyed in that sort of global health setting was what the doctors did. Actually dealing one-to-one with patients. So I came back to the United States and started medical school, thinking that I would focus on a field that would be most useful in the developing world and in global health. So I thought maybe infectious disease, or maybe trauma, or maybe even OB-GYN, things that are very relevant to to global health. But fortunately, or maybe unfortunately, what I fell in love with was surgery. And I thought that maybe this was not the best thing for someone who wanted to spend time abroad in the developing world, but I couldn't help it. And, but then I figured, before getting caught up in all of the surgical training, I took another year off and I completed a master's in public health, specifically in international health. And I spent more time in Bolivia and in Bangladesh, thinking that these experiences would help me affirm my interest in global health. And then, that was the end of medical school, and then residency started. And I started residency in urology. I'm a urologist, and this took 6 years. And different training programs are different in the world, but I'm sure that everybody listening to this who's a physician, depending on what year you are, you understand that during residency, you don't have a lot of time for anything else. So the idea of spending 6 months or a year during residency doing global health work is just not possible. And to make things worse, what I really ended up really loving was a very specific area in urology, and that's cancer surgery. So after 6 years of residency, I decided to add another 2 years in a fellowship focused on urologic oncology, urology cancers. So in 2011, after 4 years of medical school, a year of master's in public health, 6 years of residency, and 2 years of fellowship, I started my first real job, and at middle age, basically. And this was very, very exciting. And I thought maybe, well, I can finally set my own schedule, do what I want with my non-clinical time, maybe spend 3 months abroad in developing countries, maybe take a year sabbatical, maybe, actually get to do the stuff that I was really excited about a decade before. But this was really not reality. And again, I think the audience listening to this represents a very wide spectrum of seniority and experience, maybe some medical students, maybe some residents, maybe some older surgeons or physicians. But for those of you who don't know, and for those of you who already know, you understand that as new surgeons, all of your attention is taken up with the work in front of you. Seeing enough patients in an office, in a clinic, so that you actually get to do what you train for a decade to do, which is surgery. That takes a lot of time, and what patients and physicians who refer to you patients for surgery, what they want is someone who is there, someone who is available. So if you're traveling 3 months out of the year, that doesn't really set you up to succeed as a new surgeon in your home country. And I work in New York, and it's especially so like that. So after so many years of hard training, you don't want to sit and spin your wheels, waiting for patients. So you get very, very busy. And that leads to very limited time that you can initially spend, abroad. So I can go into, so in 2011, I started at Columbia University Medical Center in New York, and I am a urologic oncologist. So I basically do bladder, prostate, kidney cancer, testicular cancer. That's what I spend most of my time on. And I can go a little bit into the things that I've sort of learned, in terms of how do you integrate your interest in global surgery into a very busy clinical practice in your hometown or in your home country. But let me just see if there's anything that if you guys have any questions or anything else I can, kind of talk about before I go into those aspects. Yeah.
So why don't we stop here? I have like 5 slides that I just give a very brief overview that we actually have a global surgery agenda, and so that the audience knows what we are talking about. And then we come back and you tell us then, given your interest in global health and being a surgeon, how you are able now to kind of manage some international work with your very busy clinical.
Absolutely. I think what I would like to provide here, if I can, would be to, from a busy clinical surgeon, how I can integrate global health into this. But yes, please go on.
Então, pessoal, o que eu falei para o Joel é que eu tenho apenas 5 slides, porque eu sempre gosto de dar um overview do que certas agendas dentro de Global Health, porque, afinal, essa é uma Global Health League, para a gente entender, então, o contexto maior. E o interessante do Health não é só uma questão de doenças infecciosas. Eu acho que isso é o que o Joel traz como experiência. É uma questão global que envolve outras áreas e envolve cirurgia também. Então, eu vou compartilhar a minha tela. E você, Fernando, me diz se você está vendo aqui a minha tela.
Ainda não.
Não?
Not yet.
Not yet.
Now I see your screen.
Tá vendo Global Surgery?
Yes.
Yes.
Ok. Então, aí em casa assistindo, existem 5 bilhões de pessoas no mundo hoje que não têm acesso a procedimentos cirúrgicos e anestésicos seguros e acessíveis. E aqui, quando a gente fala acessíveis, é em termos mesmo de acesso ao serviço, de ter um serviço próximo que faça, ou ter profissional de saúde treinado, mas também em questão de financeira. Ou seja, às vezes o serviço está disponível, o serviço existe, mas ele existe apenas para uma pequena parte da população. Então, só brevemente, o que eu vou falar é qual que é o contexto hoje da Global Surgery, quais são a visão e os objetivos dessa estratégia de Global Surgery, como é que a gente vai medir se estamos atingindo uma conclusão e como pode ser feito, que é justamente a experiência do Joel.
Ju,
então, acho que é importante... Yes.
You can go in English, I think. Probably
okay.
I told everybody that this webinar would be in English, so everybody's
not a problem.
They understand.
Okay, wonderful. So that's actually sometimes much better for me to speak English because all my current work is done in English. So sometimes to know the exact translation of something to Portuguese is a little challenge. But so that's what I wanted to talk to you, give a little bit of a context where we are in terms of the global surgery agenda, the vision and goals for this agenda, and how we can move this agenda forward. Here in Brazil, there are people working on it, and elsewhere. Then the targets, so we always need, I think, if you've watched the other webinars, we normally need targets to keep us on track, to know where we're going to get. And then I'll make a brief conclusion, and how it can be done is specifically how Joel then integrates this global surgery in his current work. So I think it's important to say that surgery is a very critical part of primary health care. So there is no way we are going to achieve the Sustainable Development Goals without taking into account the role of surgery in meeting those health targets. And it's very important that we transition from this Millennium Development Goals, and I think we've talked about that during the Challenging Global Health webinar, to the Sustainable Development Goals. Why is that? Because the Sustainable Development Goals has a very broader understanding of what health is and what needs to be in place so people have, access to health, how we define health, right? So it's estimated that surgical conditions, they respond today for 1/3 of the world's burden of disease. So if that is the case, investing in surgical treatment can be very cost effective. And if we think that people that are in need of surgery are still people that are productive, like economically productive, then this highly cost effective increases even more. So this volume of essential surgery of disease control priorities has identified 44 surgical procedures that are essential for public health. Of course, we know not everything is essential when we think about the public health scheme and the scheme in global health. I think we do need to be very targeted. But if we think about the essential procedures, this is very highlighted in this. And, all the references are in the slides. So if you're interested to learn more. So as I said, surgery is part of population health, is part of primary healthcare. And we can see this as 3 levels, as a life course approach, as a disease burden approach, and a level of care approach. And ideally, what we would like to do is really to integrate these 3 things so surgery can be at the continuum of healthcare. So at all the primary health care, and then at the more specialized center and moving forward. So what is this global surgery agenda? So it's an agenda that has as a goal to improve health and health equity for all who are affected by surgical conditions or need surgical care, with a focus on underserved populations. So what is this? We know that the access to surgery is unequal. So it's not the same across the globe, and it's not the same even within a high-income country. So if we think that in underserved populations, this gap is even more pronounced, we need to have as a goal to improve this health access to those who need. The vision is that universal access to safe, high-quality, affordable surgery and anesthesia care will be available when needed to everyone. So it's a very inspiring goal, but I think that's how goals are normally envisioned are in global health, and I think that is what guides us, and we've talked about measles and etc. And I feel it's critical to have these goals to push agendas forward. And how, I'm not going into detail, but essentially, what are the key elements of the agenda? It's to have access to timely essential surgery when you need it, to have a specialized surgical workforce. Now, we can talk to Joel, are there, trained surgical physicians or, technicians around the world? Is there enough of them? Not really, not in every country. So, and then is the surgical volume. How many, procedures are being done, and the mortality related to those, and how is the cost? I think cost matters because cost can, impoverish people. It can take people to bankruptcy. So it's a very important thing to consider. And the same here is catastrophic expenditure. So there is a definition for each one of these elements. I'm not going to read them, and a specific target that we are aiming to achieve by 2020 or in 2030. Yes, Fernando? No. So in conclusion, I think when we think about the global surgery agenda, we want to know how many lack access and why. We need to understand that so we can plan interventions accordingly. How many procedures are needed? So the same, we can see cost and see where we should allocate services. And how many of those in need really can pay for the cost of the surgery? And how many lives we can save and grow the economy? And how we can make sure that surgery is part of health systems. So in the work that I do currently, my role is really work with governments to make sure that we strengthen health systems. We strengthen health systems in a way that is going to benefit not only HIV or other diseases that we might be working on, but also surgery and other services that are critical for population. So, and how it can be done, I think now let's, talk to Joel so he can share a little bit of his experience.
Joel is not Juliana.
Yeah. Why is he me?
I don't know.
Okay. Joel.
We are not
So
listening to
Joel,
you
we
again.
cannot hear you.
All right. So specifically, I don't want to. I want to give you a focused answer. So, what would you like to know specifically about my experience? Just in general, what it's been like getting involved, or specifically? Yeah.
So let me just ask you this question.
Yes.
Which is, you know that I read this article, which is very interesting, by Paul Farmer, saying it's kind of the underdog in global health. We talk a lot about global health, you know, around infectious disease and etc. There's like a big push for donors. I mean, I would love to hear your thoughts. If, in your experience, what's the role of academia and trying to push this agenda forward so, you know, global surgery can be more mainstream? And then, of course, talk about your, you know, experience, you know, going to places like Mongolia and, you know, and the Middle East, where you work with universities there.
Okay. Yes. Let me just bring something up here. Okay. So there is a general feeling, I think, in global health that surgical interventions are not as important as more sort of population-based interventions, like so nutritional status and infectious disease, and and you can probably argue that because a lot of diseases of development and infectious disease might affect larger populations more acutely. But I think it's false to say that you can't work on nutritional status, infectious disease, and surgical interventions at the same time. And as you mentioned, it's a good 1/3 of global morbidity that is involved. So it's a very large chunk. It might not be the majority, but it's a very large portion of the impact in developing countries of illness. I think within surgery, there are a lot of subsets that maybe are more important than others. So let's say, I think in that paper that you mentioned, so trauma surgery, so orthopedics, probably gynecologists and obstetricians. I think a lot of surgeries, are represented more than others. So, for example, what I do with cancer surgery, if you live in a setting where infectious disease and malnutrition, take a lot of lives, and there's a high mortality rate from births, people probably might not live long enough to develop cancer to the point that it's a major source of mortality. And that is, that's probably a valid argument. But I don't think that focusing on those surgical aspects at the same time as focusing elsewhere is not important. And to those individuals with certain cancers or certain surgical, certain conditions that need to be addressed surgically, to them, their life is equally important as for those who don't have surgically treated conditions. And if you are going to present, a total package of health services, I think surgery is very, very important. And I think I agree with Paul Farmer. I think surgery is sort of is overlooked often, and I'm hoping that changes. So within academia, I think within academia, most of the surgeons that I know who spend time abroad in global surgery are in academic centers. And I believe the reason for that is that we do have a little more leeway in our clinical time to spend time abroad. For surgeons, for busy surgeons, it's all about how can you devote time, how can you carve out time to spend a week, 2 weeks, a month delivering surgical services elsewhere. I'm sure there's lots of people listening that understand that can often be very, very difficult to find the time to do that. So let me just tell you a little bit about my experiences. I talked briefly about my time up to becoming a surgeon here in New York. During my fellowship in cancer surgery, I had never spent any time doing global surgery during residency, and the first time I did so was during my fellowship. And this is one of my main points that I'm going to talk about, is that if you're a busy surgeon, one of the most important things you can do is find and take advantage of any contacts or any encounters that you have that might open up your future life to becoming more and more involved. Again, for most of us, it's impossible to just take off for 6 months and devote that time to global surgery. So it's very, very small amounts over years, if not decades. So luckily, during my fellowship, I met one of my attendings, one of my bosses during my fellowship. He had been spending a week every year in the Palestinian territories doing what I was doing, what I was trained to do, cancer surgery within urology. And that's a very, very specific field. And as I mentioned before, going into it, I did it because I loved it, knowing that it might not be the most relevant or important thing for the rest of the world. Here in the US, prostate cancer, bladder cancer, kidney cancer is a major killer. That's not so in all the world. But I took advantage of that experience, and that was in 2009. And I've been going to Palestine, to West Bank or Gaza every single year since then. One of the important things, other than taking advantage of any experience, is making sure that you partner with an NGO that is well prepared and that that they have experience with having people from abroad come in and do work. Because if you're going to spend 3 months or 6 months somewhere, you can say, well, maybe you have time to work on things. And if one day things aren't working well, it's okay. You have a long time. But if you're a busy surgeon, chances are you're not going to be able to spend months abroad. It might be a week, might be 2 weeks, might be 3 weeks. So if things are not organized well, an entire week can go by without you achieving anything. And that creates frustration on the part of the surgeon, creates frustration on the part of the patients. So I was lucky enough to get attached to an NGO in the Palestinian territories that had a lot of experience, doing work with surgeons from all over the world, not just the United States. There are Brazilian surgeons who go there through this NGO. There are, Italian surgeons, all surgeons. Every single week, there's somebody coming. It's called Palestinian Children's Relief Fund, and it's not just for children. It's they actually bring in surgeons from all different specialties. So that gave me a really great first experience in terms of what global surgery can do. So every single week that I go, it's usually in the spring here. They know that I'm going maybe 4 months in advance, and they basically save, or they get patients from all over the West Bank, all over Gaza, knowing that I'm going to be there this 1 week. And during that week, the first day we see patients, and then for the next 1 to 2 weeks, it's just surgery that's all coordinated and scheduled even before I arrive. So organization is really, really important. And as someone who might not have a lot of time, you depend on that organization, on the NGO that you're working with. So it's very important that you identify a good NGO, and if you do, stick with them. Then, otherwise, other than making sure that you make use of any contact that you make, within every surgical subspecialty, there are societies that focus on global surgery. So within urology, for example, there is the International Volunteers in Urology. It's an organization of American urologists, and every year they sponsor multiple trips in different places. So for the last couple of years, I've also been going to Mongolia once a year. And there, again, I've focused on doing. Mongolia is a little bit better off than other places that I've been to. So there, they really wanted to learn how to do laparoscopic surgery, which is important. If we're talking about the morbidity of surgery, if you have a kidney cancer and the time between, the time that it takes you to recover from a laparoscopic kidney surgery versus open, can be weeks. And if, your family depends on, your income, and that depends on how quickly you recover, that can be a very, very long, that can be a very significant difference. So also, I would say one of my recommendations would be to tap into your subspecialty within surgery, your specialties, national organizations, and I am absolutely sure that in every single country in the world, within thoracic surgeons, urologists, gynecologists, there are societies that focus and spend time abroad, doing global surgery. So I think that's a very important point. But I think being someone who 7 years ago I finished my training, probably the most important thing is that you have to take it slowly. There is no way, as I mentioned before, there's no way that right after you finish training, you can now take off 6 months or a year, or at least in the United States. It's just not feasible. You now have to start working, and you now have to start using what you've spent a decade learning how to do. So just work slowly, and maybe. So what I did was the first year I took a week off and went abroad. And now 7 years later, I routinely take 3 weeks off, not at once, 1 week or 2 weeks, and go to different places. And I have a lot of contacts that, I trust, and I know that once I go there, I will be able to get a lot of work done. And it's been really satisfying, perhaps at some point down the line, maybe I can take 3 months and go on sabbatical. Not right now, it's a little bit too early. And I envy those people who can do that. And then, so in terms of taking advantage of opportunities, so with Juliana, I got involved with ICAP. And that, is involving, I'm involved with male circumcision in order to reduce the rates of HIV infection. And that's another example of, it's an opportunity that presented itself, and I was able to take advantage of it because, one, I was interested, and more important, I was committed to that aspect. So there will be always opportunities, if you're open to it, to take advantage of.
Joel,
Yes.
one more question. In your work in Gaza, does it include training any physicians, any local health workforce to do the procedures?
Yeah, so that's an important point. There's different philosophies. If you can argue that if you're going in for a week or 2 weeks and doing even 30 or 40 surgeries, what effects are you having overall in that population? And you can argue that the effect might not be very big. So I believe that everywhere I go, the main goal is to train local surgeons. And that can take a long time. And these are people who are trained as surgeons. We're not going to train non-surgeons to do surgeries. That's not responsible or feasible, really. But we're able to train, I train general urologists to do bladder cancer surgery or do kidney surgery. And during that first week or second week, that's not sufficient to get them comfortable, but year after year, and I'm not the only one who goes, but you're contributing a small amount of education that added up during the entire year of different people coming and different people training does add up over the years. So I did not mean to say that we go in and just do surgery. The main goal is to train others to do that surgery, but as you do so, you're also treating patients. So yeah, that's very, very important. The training is very important.
Joel, one thing, how much does it cost for you to go to Gaza or some places like this? Because I think someone is thinking about to go somewhere like this to do surgeries too, and you have to plan how to do that. And how much does it cost?
And you mean cost me to go there? Yes, that's a very important point. So the idea that first you're taking time away from your practice, so that's a cost to you, but then traveling to these places is also a cost. So It depends on the type of NGO that you work with. So there are some NGOs that I've worked with that have good enough funding from other sources, be it their government or from private sources, that they've actually been able to pay for my flight and my where I stay. So in some cases, I haven't had to pay anything. Usually, those NGOs want people who are more senior and well trained, and for example, they probably wouldn't pay for a resident or a fellow to go. But I would say that that's the minority of NGOs. Most NGOs, in my experience that I've gone, they might provide transportation and maybe lodging, but you have to get there. So for example, for Mongolia, for example, I've gone and I do have to pay my way there. And a ticket from New York, it depends on where you're coming from, but from New York to Mongolia is a good $1,000. And most NGOs will set you up with a family member or somebody to stay in that area. So the costs while there are not very high. But yes, travel expenses can be significant. And that really stresses your commitment to this, because almost by definition, the places you're going to don't have a lot of funds. And for them to, if they have difficulty funding their own surgical operating rooms and the training for their own surgeons, chances are they're not going to have a lot of money to fly somebody from Rio or from New York to come in for a week or 2 weeks to train. That's unfortunate, but that's just the reality of it. So it does take commitment in terms of time and your own funds, and that might seem difficult for people if you say, well, I'm spending my own time to go there, and I also have to spend money to get there. But that's the reality in most of the world, and in most of the places that global surgery would have the most impact. The places where you will have the most impact are the poorest typically, and therefore they will not be able to pay your way. That said, sometimes hospitals, especially academic hospitals, might have funds for people to travel and do work abroad. And why do they do that? I mean, I'd like to think it's because they're humanitarian and they want their doctors to go out and help people, but also it probably makes them look good. The fact that they can say that our surgeons go here and there and they do this work, but that's okay. They could feel good. And my goal is to provide these services, and however I can do it, I'll try to do it.
Yeah, politics and publicity is the same in everywhere in the whole world, I think.
It's not an American invention. No.
Se alguém tiver they mastered in America.
Yeah.
If someone has some question for Joe, we'll have him for another 20 minutes. And you can put on the chat and the chat box right over you. So Joel, I want to ask you something. If you could, please put the links on the chat box to our listeners can find some information for them how they can go abroad to make surgeries.
So I just want to say something that Joel brought it up, which is the question of how these organizations are funded. I think when we read the global surgery agenda, one of the pieces they emphasize is that if we really want to have a global surgery agenda, we need to ensure that we get funding for it, for different sources, because of course, the places that need the most, they normally don't have the resources to allocate, specific parts of the budget to increase, surgical coverage. And I feel that, at least I am not aware of specific funding to fund global surgery. I mean, I'm really not aware. I don't know if Bill and Melinda Gates or, there might be for sure, even for other, donor agencies outside the U.S. but that's definitely a big concern, because then you end up relying on, a small pool, of resources to actually do the work.
I agree. I have not come across any kind of federally funded global surgical funds. That just doesn't exist, and I think that's a reflection of what you said, and what Paul Farmer writes about, and that global surgery is underappreciated, because of compared to other aspects of health, it might not be as important. It doesn't mean that it's not important, but it's not as important. But I hope that it is very important, and I think that perspective is changing slowly. So hopefully in the future there will be more funding. I know in the U.S. there is no. I've looked often, and there is no funding from USAID or anything specifically for surgical services. Yeah.
So, Joel mentioned the project that we collaborate together on male circumcision and HIV. We'll be talking more specifically about HIV and prevention and the role of voluntary medical male circumcision in another webinar, so we don't want to spoil that. But that's a good partnership, because I think Joel brings the technical expertise. As you can see, I'm not a surgeon. My background is very clinical. And but it's a good match, because then he can make sure that the services that we provide are high quality, that we are meeting the quality standards, even in very, very rural places. So I think that is critical to have someone, Joel, with your expertise to work with us in that endeavor.
It certainly is.
I mean, and it's been an absolute pleasure working with Juliana and the whole ICAP team. But yeah, it would be great to do a whole webinar based on that, and I would love to contribute to that.
Oh, great. Joe, this Global Health League, we're trying to, as I said before, we're trying to connect people. So thank you for letting your email here. So if someone wants to contact Joel, it's GJD16 yeah, you can see right over here. You have a different email from Colombia. It's very long.
Yeah, they recently added the CUMC. It used to be just aroba@columbia.edu, but they made it more complicated. I don't know why.
Yeah.
I have both. But
you do?
Both.
Well, yeah. So you're more senior. You're more important. You're more senior than I am, I guess. I don't get both. I only get one.
Well, they have been there long. I don't know, but I have both, so they merge.
Joe.
See the chat. Is there? I don't know why I don't see. Do you see the chat?
You have a red 3 dots on the right side of your screen.
Yeah.
Click there.
I did. Yeah.
Now you
see the
chat.
I see now. Okay. I'm also a little bit. Okay. The other thing that I was going to say, if people want to ask questions in Portuguese, that's fine as well.
Yeah.
I speak Spanish, so I can probably read Portuguese a little bit. I
think so. We have Claudia here. Claudia is from Peru.
Yeah. Oh, Peru. Hey. Hola, Claudia. ¿Cómo estás?
We're trying to make something very plural here. So, Claudia, if you can invite your colleagues to the next Global Health League webinars. We're trying to make this bigger. Any questions, guys? So I have a different one. We hear a lot that is a problem in urology and the organ traffic and how this can be seen on a global health approach, on a global surgery approach, if this is a thing that you consider on this kind of approach in healthcare. Sorry about the question.
Yeah, that's an interesting question. Organ trafficking, like kidney trafficking, you mean?
Yeah.
Yeah. I mean, I can tell you that, well, that there are no-go statistics on that. But it's bad. We're against it.
I know. Everybody is against it. I'm sorry about that.
It's very bad. But no, I mean, clearly that's something like a lot of abuse of poor people, especially in developing countries where individuals are taken advantage of because of their economic situation, and this is often seen as the only possibility of making some money. So organ transplantation obviously it's organ donation in any kind of coercive way is absolutely illegal and is completely immoral and it's completely unethical. I think it still ends up happening. It's clearly not an accepted practice anywhere. How do you address that? I'm not going to pretend to know how you can address that. Beyond the addressing the economic reasons why people find themselves in the situation where the only thing they can do is donate or have an organ removed. That's this. I don't know if this is a good analogy, and sorry if I shouldn't be saying this in this webinar, but it's almost like sometimes prostitution or traffic, like sex traffickers. It's something that is absolutely abominable. To traffic in these things, but it's a reflection of inequities in society that just saying that this is bad is probably not going to fix it. I think as long as there is poverty and as long as there are unethical people willing to take advantage of others, I think it's going to be very difficult to get rid of it completely.
Okay.
Yeah.
Yeah, I'm sorry again about the question, Joel.
Any easier questions?
No, I have a question. It's not about that.
Sorry.
That's great. No.
Renew now.
So, Joel, I don't know if when you go to the Middle East, the West Bank, and Mongolia, if you've had the chance to see what the national statistics for urological cancer, if they keep good record, or if this is something that it's very, an estimate and they are not sure. What sometimes is that we lack enough data to kind of inform, implementation of services, things like that.
Yeah, every cancer is different, and for example, let's take one extreme within my field, prostate cancer. For the most part, prostate cancer is a disease of the elderly, on average 67, 68 years old, and mortality from prostate cancer probably occurs, probably in your late 60s. Now, if you live in an environment where the average longevity is 58, then prostate cancer is probably not a big focus, and it probably should not be a big focus. That said, there are other cancers within every specialty, and even in urology, that are very aggressive. So bladder cancer and kidney cancer and testicular cancer, those can be lethal early in life. It's if I had the choice of making a high risk OB clinic versus a urologic cancer clinic in a developing country, obviously it should be a high risk OB or obstetrics clinic. But that said, there's still a role for example, and this is where working with a very well organized NGO comes in. So for relatively rarer cancers in the developing world, like kidney cancer or bladder cancer, let's say if they have a group every 6 months who comes in and helps do these surgeries, that's probably sufficient. until the team there knows how to do these surgeries. But if I go somewhere every 6 months and they basically refer all patients with bladder cancer, and we spend a week doing these surgeries that take 5 or 6 hours, we probably have addressed a big proportion in that population who have this disease. You are right. So in Mongolia, for example, where the average life expectancy is, it's less than 70, things like prostate cancer are not a big problem, but other urologic cancers are. So we tend to focus on those when we're there. And that is the way it should be. Not every condition, we don't need to devote time and energy to every single condition. I think it's best use, money and time is best used within your specialty to address those things that are most lethal to people. Because again, we're trying to train individuals to do these surgeries, and we're trying to have an impact in the society, in that society as a whole. And how best to do that within my little field, it's to focus on the cancers that are the biggest threat. And that's different, in every country. And that's going to be different for every surgeon. So for, if there's an ear, nose, and throat surgeon who goes somewhere, maybe the most important thing is cleft palate surgeries. Because even though those are not life-threatening, that actually causes a lot of downstream, issues for the rest of that person's life. And while you can say it's not cancer, well, not everything has to be lethal to be important. If you have a disfigurement that can actually affect your nutrition and your life, as a member of that society for the rest of your life, then it's equally important, I think, as a cancer. So I within every field there are priorities, I think.
Wonderful. That is a treat. I don't know if anyone else has any questions, Fernando, or anyone in the audience.
Fernanda perguntou de alguns sites. O Joel colocou, está sobre o nome da Juliana, mas ele colocou Palestine Children's Relief Fund and the International Volunteers in Urology. Here in Brazil, we have Médecins Sans Frontières. They're very famous here and well found. Do you know anything about their work? And we see on the television, please help the Médicos Sem Fronteira, we say here.
I don't know all that much about Médecins Sans Frontières. I actually applied to work with them. I wanted to, before I started my first job in 2011, I wanted to take about 3 months and actually work with them. However, they're, rightly so, their requirements are quite high in terms of your time commitment. So they would never have somebody go to the sites they go to for a week or 2 weeks. Partly is because they don't only work in developing country and resource poor settings, but they often work in conflict areas. And regardless, they're a very, very well organized NGO, but sometimes it takes a long time to just get things started within a conflict area or a war affected area. So there's no use in somebody going for a short period of time. So my point is that for surgeons, for example, they actually have the least amount of time, which is 3 months. For if you're a nurse, if you're a general practitioner, they still have use for you, but you have to commit more to a year. So and they do pay. You're going there, they give you a stipend, to live on. So there are some individuals who devote their careers or years of their careers to MSF. But it is very difficult, if not impossible, for most practicing surgeons in the US, and I assume also in Brazil, to take 3 months all of a sudden from their practice and just go to wherever they might be. So yeah, so I was rejected from MSF. I was that.
Não, no.
Yeah, but it's an absolutely wonderful organization, I honestly I hope that in the future perhaps I can actually work with them. We'll see.
So I think one of the things that is we can talk on an individual level, which is very important. Like, okay, how a young surgeon or a surgeon can do like you do, go abroad and contribute. But I think there's also like how can we move the agenda forward? Have you ever considered being part of the Commission for Global Surgery? Or would you be interested in that, or that's just not your Joel?
I would absolutely love to do something like that. I mean, I think it's important. I think as I mentioned, to kind of start off slowly and make sure that you're not biting off more than you can chew with different responsibilities. I think I've been an attending surgeon now for 7 years, and it's only now that I have a practice that is stable enough that I can leave for periods of time, or I can devote chunks of time to doing something outside of my main job of being a clinical urologist here in New York. I would be very interested in doing something like that, because I think that's while it takes time, you don't have to be abroad, you don't have to be traveling. I'd love to talk to you more about that, offline at some point. Yeah,
because I do feel that's also a way of improving the health of many, because at the end of the day, you are also helping shape like the global response, which I see it as an important opportunity.
I agree. I fully agree. Yeah. We'll talk more.
So I'm giving you ideas.
I know. No.
She's always like that, I think. I just know Juliana for 3 months right now, so I'm learning a lot with her.
Yeah, Juliana's a master multitasker. Master, yeah.
And this is kind of jeitinho that we Brazilians have to be multitaskers, and I think we can, us and other underdeveloped countries are always fighting with something, so we have to be creative and do lots of stuff in the same time. It's about almost a cultural thing here.
Yeah.
And you'll probably see that abroad too.
Yeah.
So what's you can.
So sorry. I while talking, I've been I don't know why it shows up under Juliana's name, but I've been cutting and pasting some links to MSF, to the Global Health website, the Palestinian Children's Relief Fund website. I'm just, if I assume people will have access to this later on. I'm just trying to provide some websites. But yeah, I mean, I think it's again, given the amount of time and attention and immersion that a surgeon's career requires, now saying, well, I'm going to take weeks or out of that and travel somewhere and do additional work, that's often very difficult for people to do, to get their minds around. So I think a lot of us start off with very good intentions, from medical school and residency, but soon we're met with reality. And what I would like to make sure that medical students or residents who might be listening is that it can be very, very difficult. But as long as you take it slowly and take advantage of opportunities and know that you've entered into a field that is overwhelmingly busy, adding something else to it that takes a lot of time and energy and emotional energy, it's difficult, but I think it's very, very worthwhile. Donating the skill set that you acquired over decades of training and going to a place where they don't have individuals with the luck and fortune that you have had to have this training, that is immensely gratifying, and it's something that can be life-changing. And while while governments might not think that is as important as other aspects of global health, I can tell you that some of the most satisfying experiences and some of the most grateful patients have been in Mongolia or Gaza Strip or West Bank, for after doing a surgery that they don't have the skill set there to do, because those individuals did not have the fortune of being able to go certain places for the training to do these things. So it's worth it, as most things that are worth it, or most things that are worth it are very difficult, and it can be very difficult, but it's been done before. And hopefully with this, these webinars and, lots of, online resources, you can get more and more involved.
It was great to have you here, Joel. It was great to know you, to chat with you, and to know better the global surgery. And this is our dream in some kind of way, that we are connecting people and making things happen by this whole creation process that we're passing through here, Global Health League, Academia Médica's Global Health League. So,
sorry, go ahead, Fernando. You were breaking up a little.
No, I'm amazed by his story, and and again, it was a great time to have you here.
Well, it's my pleasure, and I hope that I can come on regularly and talk, and as more and more people get involved, anytime. Yeah.
Joel, I so much appreciate your time and you having time to do this. Really, thank you. It's a big thank you. I know you're busy.
Oh, it's okay. As you can see, I'm just in my little office right now. So we just finished some surgery. So I would love to be involved whenever possible. Thank you very much for inviting me. I appreciate it.
Okay, bye-bye, guys.
Wonderful.
Bye-bye.
Bye-bye.